All right, also associated with Chapter 14 in Epidemiology are what's known as nosocomial infections. All right, these are a very specific type of infection. This is an infection that is acquired in a healthcare setting. So if, for example, you go in to have surgery, the surgeon cuts you open, does what they need to do, seals you back up, and then you end up with an infection, either like a urinary tract infection due to the catheter that they had to insert, or if the wound becomes infected, this would be an example of a nosocomial infection. It's going to be a disease that is either acquired or happens during a hospital stay, all right? And in terms of this, where this becomes important for you as a healthcare provider, all right? Like it or not, you're going to have to deal with insurance companies, and they don't like paying for hospital-acquired infections, okay? Because in terms of this, we're talking in the range of 2 to 4 million cases of nosocomial infection that occur a year, okay? And in terms of this, this is something that can potentially be reduced. I don't think it can be entirely eliminated because one of the sources of nosocomial infection is actually the patient themselves, okay? Because they can have normal flora that get into places that they aren't supposed to, okay? But in terms of where this can have an impact is going to be with your aseptic technique, okay? In terms of that, paying attention to things like, okay, if I'm going to put a catheter in this person, I don't want to take the catheter out and put it on the table where the patient has eaten, okay? Or I don't want to put it down on the bed where the patient may have peed, or there may be fecal matter on the sheets, because you can pick that up. That catheter then becomes a fomite, and it transfers an infection to another individual. Okay, so in terms of nosocomial infections, these are really critical, and you as a healthcare provider can really have a big impact on reducing this for your patients. Okay, pay attention to where you're placing things, what you're doing. Washing your hands is going to be really important as far as nosocomial infections. Using proper protective measures. If you're going into a room with a patient that you know has MRSA, that you put on all the protective equipment that you're supposed to. Don't shortcut things, okay? Dispose of any material that comes in contact with that infectious patient in a proper way. Because in terms of nosocomial infections, really the places within a hospital are unlimited as to where that infection can come from. It can come from the hospital staff, although that's not necessarily the most common. It can come from the patient themselves. It can come from the environment in the hospital. If the cleaning crew doesn't clean the bed between patients, all right? Bedpans that don't get cleaned properly. Catheters, all right, can also be a source of nosocomial infections. Anything where you've got tubing that's reused, like with certain respirators, that tubing is cleaned, and that can be a way to transmit things. The water within the hospital or the healthcare setting can be a way that that can be transmitted, okay? So there's really endless ways that that can happen, all right? Because essentially what we're talking about is within that hospital, there are reservoirs for infection, all right? And in terms of reservoir for infections, some of the main reservoirs are going to be the personnel, the hospital personnel themselves, okay? Because we carry bacteria on our skin, It's on our hair, all right? It's in our nose, all right? So the healthcare personnel can be one source. Patient can also be a source because, again, there are bacteria on the patient's skin and their nose, on their hair, okay? And in terms of that, when we're talking about the personnel or the patient, the normal flora, if it gets into places it's not supposed to be, can cause what's known as opportunistic infections. Okay? Meaning you have a bacteria that's normally associated with the body, but if it stays on the skin, it doesn't make you sick. Once that surgeon makes that incision, now that skin is potentially exposed. The bacteria on that skin can get into that incision that was made. That's why when people are prepped for surgery, they're cleaned and the skin is cleaned as best it can be, all right, to reduce that kind of transmission of disease. It's not probably reasonable to eliminate it entirely, but it certainly can be reduced, all right? Last main source for those reservoirs are going to be the environment itself, okay? Like it or not, there are viruses, there are bacteria, there are fungi that are circulating in the air that you breathe. Our bodies have adapted and evolved to be able to filter a good bit of that out, okay? But in addition to the air, things like instruments that are used within the hospital can be a source or a place where bacteria or viruses live, all right? And then things like improper use of an antiseptic or a disinfectant. If you don't use the right cleaner on the right surface, you're not going to eliminate the potential bacteria or viruses that are harbored in that area, okay? So when we're talking about reservoirs of infection, we're talking about places where the bacteria or the virus can exist, all right, and can be introduced then into the human population, all right? Kind of a bit tangential to the nosocomial infections because really these three reservoirs of infection are what we're talking with nosocomial infections, all right? You can have other reservoirs. All right, insects and animals being the most common, all right? This is going to be an example of something that's a zoonotic disease, all right? A zoonotic disease as far as transmission is going to go from an animal source to the human population. So things like Lyme disease would be an example of a zoonotic disease. That deer tick carries the bacteria associated with Lyme disease, transfers it to humans when they bite the humans, okay? Rabies is another great example of something that's a zoonotic disease. Goes from the animal population to the human population, all right? So in terms of that, really with epidemiology is focused on where the infection comes from, how it got there, and then in terms of that, what can be done to control it so that it doesn't continue within the population, all right? If you have any questions, please let me know.